Well, the fight against COVID is ever changing, and so are the new tools being introduced to help us get through this ongoing pandemic. And we're joined now with Dr. Malathi Srinivasan with Stanford Health Care for the very latest. Thanks for being with us today. Let's talk about the new Novavax vaccine. What makes this different from the others that we've all been getting the last couple of years?
Yeah, and thanks for having me today. So the Novavax vaccine is a more traditional vaccine, and that uses the same technology that we use for shingles and for the influenza virus. It's cleared a very critical step in the FDA authorization pathway, where an independent advisory board has now recommended that it be authorized in the United States. And the way the Novavax vaccine works is that it takes a virus, in this case, an insect virus, that infects other cells, in this case, moth cells, that then grow up only the protein that we're interested in, which is the spike protein. The spike protein is purified and it's mixed with an adjuvant, which is a little booster to be able to help stimulate more of an immune response. And it seems like it works really well. Now, here's the rub. The study initially that showed that it was effective came out in June of 2021, so a year ago. And there were a whole bunch of delays in getting it authorized. There were some questions about manufacturing and a few other things, but frankly, it was working as well as the mRNA vaccines, and it was already being used in Europe and in Japan. So we're not really sure why the FDA had delayed it. And I think people are concerned now that it has the same problems as the mRNA vaccines, which is that it was developed with the original strain of the COVID vaccine, so Alpha. And it's not really clear how well it will work against Omicron. But my guess and the guess of most experts is that it's going to work as well as the mRNA vaccines, which are also using the same spike protein and the same spike protein technology.
Well, let's see how that comes along once that's actually approved. Meantime, Moderna working on another COVID booster, and this one is potentially superior to the original, at least according to the company. What's your take on that?
So Moderna and Pfizer are both developing mRNA vaccines that are specific against Omicron. And it's taken a long time to come down the pike. We don't know if the new Moderna vaccine is going to be that much better than the original vaccine. And that's because that's for several reasons. First, you already have a pretty good immune response with the original vaccines, and the booster certainly helped to prevent infection and reinfection. But how much of an additional boost we're going to get with Omicron is still a bit of a question. We think we're probably going to get a 10 to 15% gain. Now, it's taken a long time for this to happen. Originally, the Pfizer president had promised that after introduction, we would be able to get a new vaccine up and running in about 100 days. And it's been over 200 days since both of them started working on the vaccine. Both Moderna and Pfizer started working on the mRNA vaccines. And it's not really clear what the holdup is. And it's probably for two reasons. The first is that, again, there's questions about how much more effective the vaccine is going to be. I think, again, it'll probably be a little bit more effective. But second, the only 50% of people who are vaccinated in the United States have already gotten a booster. And it's not clear how much of an appetite the American public is going to have for yet another Omicron vaccine. We hope that it will be a very strong uptake, but that's not really clear. So I think between the two of those things, with an unclear patient pool and an unclear efficacy, I think the companies are waiting a little bit to see what the actual studies show. And both Moderna and Pfizer have studies that should be finishing up in the next couple months.
Okay. Now, you mentioned reinfections. What is the latest on that? Somebody who's gotten Omicron in the past, are they still protected from getting the latest variant that's out there? Where do things stand?
Yeah, and these RNA viruses are mutating very quickly, and reinfection is definitely a reality, especially with the new variants. Now, the COVID reinfection is very likely under certain circumstances, right? First, if you've gotten vaccinated and your immunity has waned, which is usually about 5 to 6 months after the vaccine and booster, and about 3 months after a natural infection, and even less if your infection was mild. So originally, if you were infected with alpha, you were pretty well protected against getting Delta. It was like an 80% reduction in reinfection. But if you were infected with Delta, because Omicron is so much different, you were only about 50% protected against the Omicron variants at 2 months. Now, this was based on a study from Denmark. But what we do know is that if you had like the Omicron variants, they're close enough that those infections seem to give you some lasting protection, maybe about with only a 20% reinfection rate at a couple months. So the take-home message is that if you are experiencing COVID-like symptoms in a month or two after being infected, please go get retested for COVID.
Okay, now for people who do test positive, we know the health guidelines are always evolving, always changing. What is your take on exactly how long they should be isolating?
Yeah. So we think that most people will stop being infectious at about 5 to 7 days after becoming symptomatic, and that the antigen test correlates pretty well with actively circulating virus or virus particles. But we've had patients at Stanford coming in to see us who are antigen positive for 10, 14, even 20 days. And so the question is why, right? So part of how fast you clear out the virus after infection is based on your immune system, how active it is if you've gotten vaccinated and when you had your last booster. And the antigen tests are not as sensitive as PCR, which will pick up, viral particles for up to a month, sometimes even a month and a half. So the antigen tests, we think, correlate much better with whether or not you're still infected, so with infectivity, than the PCR tests do. And if you're still positive at, say, 5 days or 10 days, it's for one of two reasons. One, either you're asymptomatic and you have circulating virus that's live, and it's taking your immune system a long time to clear it out. Or two, your immune system has done a great job of clearing out the virus and is just cleaning up all the debris that's still there. So there's a lot of debate about what to do. From my perspective, the most prudent thing to do is wait until the antigen test is negative, especially if you are going to be around people who are immunocompromised or if you have a public-facing job. But the CDC is currently recommending that you should stop isolating after about 5 days and wear a well-fitted mask for at least 10 days. Now, when they came out with this recommendation, they were very clear that they were trying to balance the economic impact of isolation with the medical reasons to stay isolated. But we're trying to encourage people to take a more tailored, personalized approach and using the antigen test as a good marker of when they are clear to go back to their more normal public-facing life.
Okay, and that antigen test is the one that most of us have at home, the one that we've been getting free from the government, the one that you can just, do in your living room, right?
Exactly. It's the home 10 to 15 minute test that you can do at home.
Okay, very good news there. A lot of good information. Thanks so much, Dr. Malathi Srinivasan with Stanford Health Care. We appreciate your time.
Thank you so much, Anne.